Dr. Beverly Malone. I'm the president and CEO for the National League for Nursing, and I have the pleasure of talking with you today for a brief time about diversity and inclusion and a little bit about racism. There is so much to be said about diversity. The National League for Nursing's definition is affirming the uniqueness of and differences among persons, ideas, values, and ethnicities. So diversity is more than just race and ethnicities. It's about a different way of thinking. And can we tolerate and engage in that? And engagement is a big part of it, because you could count the number and you could say, oh, we have a diverse group here. But the real diversity would be about whether or not there's engagement, collaboration. And I kind of came up with this idea that without diversity, there is no excellence, just absolutely no excellence. The NLN definition for excellence is co-creating and implementing transformative strategies with daring ingenuity. So to get to that level of excellence, and I know every nurse wants to get to that level, it means that diversity has to be a part of what you're doing. The other interesting piece is diversity and inclusion takes a lot of individual reflection, self-examination, because we all grew up with implicit biases and we don't even know they're there. And I think that when we're working as nurses, and we understand and we really examined our implicit biases, we've taken them out and looked at them and examined them, we can actually say, I can manage these. I can actually provide the care that's needed and acknowledge that I have these biases. When you don't know you have them, how can you give quality patient care? You don't even know that you have a bias that could be affecting the way you're delivering the care. But it's bigger than that, colleagues. It's not just about an individual level. It's also about a systems level. And racism often comes in at the systems level. That's usually called structural racism, where you have policies and you have institutional ideas and they're all combined and worked, and you don't even know that that's there. So that's kind of an unconscious bias also. I would just encourage you all to watch the unconscious way that we do things and do some self-examination, some self-exploration, and work with your colleagues, your fellow nurses. Can you help me if I'm starting to move over in that direction of seemingly not able to manage my unconscious biases? Can you take care of that patient? Because I'm a little bit concerned that I may not be able to provide the kind of care that is deserving. I'm still working on those biases that I have, that I know about, and that I will take out and examine and grow. I will grow and grow and grow because nursing deserves it and because our patients deserve it. Thank you for this small bit of time just to speak with you about diversity and a little tiny bit about racism. All the best to all of you.